Johne's disease is a bacterial disease of cattle and other ruminants for which there is no cure. Cattle become infected as calves by drinking milk or eating food contaminated with the bacteria, which is shed in the dung or milk from infected adult cattle. Once infected, the disease progresses slowly. Clinical signs usually are associated with stress and only become obvious in animals from about 3 to 5 years of age, but sometimes animals can be younger. The most common symptoms are weight loss, severe diarrhea that does not respond to treatment, soft swelling of the jaw or bottle jaw, reduced yields, and death. On-farm control of infection requires a dual approach of testing to identify high-risk animals for particular management and protecting calves from ingesting the bacteria by removing the sources of infection and maintaining high standards of calf hygiene. Excellent standards of calf hygiene immediately from birth are essential in preventing calves from becoming infected with the bacteria that cause Johne's disease. It's important to remove calves from their dams as soon as possible after calving so that they have minimal exposure to cow dung in the pen and on the teats. This could be to a nearby clean refuge made of straw bales or individual calf pens. Soiled bedding should be removed and calving pens thoroughly cleaned as often as possible and replaced with sufficient fresh bedding to keep pens clean and dry. It's important to calve high-risk cows, such as those that are test positive, in poor condition or bought in a separate pen and clean out immediately after calving. Avoid spreading dung or slurry on land that is likely to be grazed by young calves in the following spring, as they are still at risk of picking up infection during the grazing season. Colostrum or milk should be collected from cows as hygienically as possible, as fecally contaminated milk may contain the bacteria that cause Johne's disease, and young calves are very susceptible to becoming infected. Calves must only be fed colostrum and milk from their own dam or a known low-risk cow, for example, a cow that has repeatedly tested negative for Johne's disease. Avoid obtaining or using colostrum from herds of unknown Johne's status, and the use of pooled milk increases the risk of calves becoming infected by Johne's disease. Worried or concerned by Johne's disease? Why not join the Irish Johne's Disease Control Programme? The programme provides fully funded advice and planning for your herd from specially trained veterinary practitioners, and assisted testing to see whether your herd is infected and to identify high-risk animals. Johne's disease is a challenging condition with multiple factors associated with its spread and impacts, but the IJCP is endorsed by your milk processor to give you the information and supports you need to control it effectively. Contact Animal Health Ireland for more information.